In this video, we're going to be talking about post-op recovery after hernia surgery. Now, it depends on the type of hernia surgery and the extent of it and such, but these are some general guidelines. Patients should not drive or operate heavy machinery for 24 hours. That's because of the effects of the anesthesia drugs can still leave people a little groggy or delay their reflexes and such, and so that's where that comes from. We generally recommend and want someone to be able to stay with a patient after their procedure, especially the first night. For groin surgeries, I usually recommend using ice packs on the groin. We say 20 minutes on, 20 minutes off. You don't have to be very religious about that, but ice packs in general help. For groin hernias, wearing spandex bike shorts or compression underwear is helpful to limit the swelling. Depending on the size of the hernia, sometimes I say do it for a week. Sometimes I say do it for 2 weeks. Men with large scrotal hernias, many times we'll send them with the scrotal support, and I usually have patients wear that for 2 weeks, and this really helps keep the swelling down. How long to keep the bandage on? The bandage, again, depends on the location, but for a groin hernia or an umbilical hernia, I usually recommend keeping the bandage on for 2 to 3 days. I use a type of a pressure dressing to minimize swelling, and then at that time you can carefully remove the dressing. Underneath are usually steri strips. Some surgeons use glue. I tend to use steri strips. The steri strips can remain on. They're little usually white or sometimes brown colored stickers that stay on the skin, and they protect the wound. You can shower over that, let the water run over it, and pat dry. They'll eventually fall off in a few weeks usually. Don't submerge the incision in pools or tubs for 2 to 3 weeks or until it's healed. So for all hernias, I personally continue to follow the old ways of no heavy lifting or straining for 6 weeks. A lot of surgeons have really lowered that and are letting patients get back to full activity, some as early as a few days, many 1 to 2 weeks. I still recommend to wait the full 6 weeks until the tissue has reached most of its healing. Traditionally, in studies on collagen healing, they found on average at around 6 weeks from an injury, the tissue has healed and reached a new plateau of about 80% of initial strength before the injury. So in general, I like to have patients wait that time. Doesn't mean you can't do anything. I let patients get back to light activities within a few days, exercises within a week or two, based on how you're feeling. And I just don't want straining and heavy lifting, but light activities is not only okay, but it's a good thing, so that you don't become very deconditioned during the recovery process. To avoid constipation, use prunes or Miralax as needed. As far as we know, Miralax is very safe. So it says to take once daily, but you may need to take 2 to 3 times daily to keep going initially after surgery. The anesthesia medicines, the pain medicines can sometimes slow down the GI transit. For pain control in general, I recommend using Tylenol and Advil. If you have liver disease, Tylenol may be limited. If you have history of stomach ulcers or such, Advil use may be limited. And we do generally prescribe other pain medicines to help, muscle relaxers such as Robaxin, nerve pain medicines such as gabapentin, and then a stronger pain medicine, opioid like oxycodone or tramadol, use as needed. Many times if all the other medicines are used, many times no opioids are needed or very few. People ask about bending and twisting. That's okay. That's not going to hurt anything. If you do any movements that cause pain, obviously limit those movements and just be slow and careful. Swimming is generally okay after 2 to 3 weeks after the wound has healed. How long will you be out of work? Obviously, that depends on your work. In general, for the first 3 days after a groin hernia surgery, expect to be having some pain, so just relaxing at home is ideal. Some people get right back to work, especially if it's a sedentary job or computer work or phone calls or management. These sorts of things can be done right away. Exertional jobs usually take about a week or two to get back to, and even then at light duty, no heavy lifting. I prefer to do no heavy lifting for 6 weeks. how long until you can drive? So we generally say you should not drive for 24 hours after the surgery due to the effects of anesthesia. However, in general, I think it's likely safe to avoid driving for 3 to 5 days after surgery, just depending on how your recovery goes and how you feel. Now, a lot of these things don't apply to small umbilical hernias. Many times patients are getting right back to things pretty much right away. I want you to, one, not be on strong pain medicines like an opioid, which can impair your reflexes and ability to maneuver quickly. And also, I would like you to not be having pain where if you had to make an emergency maneuver, you don't get a sharp pain, which limits your ability to do the emergency maneuver. So if patients are traveling soon after surgery, obviously I prefer you to not travel right after surgery. There is, every time you have surgery or anesthesia, there's going to be a slightly higher chance of a deep vein thrombosis or a blood clot due to some inflammation in the body. So the longer you can wait, the better. Having said that, people sometimes have to drive a distance the day of surgery or fly the next day or things like that. And we can take precautions in those scenarios. We have special instruction forms we give patients with exercises. If you're flying, we like you to walk as much as possible. I know that's difficult, but you can do calf raises and knee extensions as best as you can with the seat in front of you. We say to do 10 of those every 15 minutes while you're awake. And we can do other things like take aspirin or a blood thinner, which we can prescribe for the travel days. If driving, it's a good idea to stop every hour or so and walk around for 5 to 15 minutes, use the restroom, drink water, and just get the blood flowing.